Hello, my name's Dr. Drew Hall. I'm the president of the Blair Upper Cervical Chiropractic Society. Blair Upper Cervical Chiropractic, simply, it changed my whole life. I was in high school, I was on the baseball team, and I got in a wrestling match with a buddy of mine. I was losing, and he had me completely upside down, and not on purpose, but he lost his grip on me, dropped me flat on my head, and I had absolutely no idea how that one moment was going to radically change the entire landscape of my life. Over the next 6 months, slowly, I developed all sorts of healthcare problems. After 2.5 years of suffering literally every day and things not getting better, getting worse, and me feeling, kind of hopeless because I've been to all these doctors and no one's helped me to this point. And the irony of the whole story is the last person on planet Earth that I thought would get me better was a chiropractor. Literally every symptom I had, which was upwards of 30, disappeared, and I was living at a level of health that I didn't know existed. And it was all because I got to the right person at the right time. They had the right information. And I often think about, had I gotten to another chiropractic office, I'm a fan of chiropractic, but I know without any shadow of a doubt, if this is not done correctly and precisely, I wouldn't have gotten the same result. Whether you learn static palpation, motion palpation, all of these procedures that are there to determine how someone's out of alignment are based on a symmetrical model. So if you palpate someone's atlas, you're feeling, is it right, is it left, is it rotated? But what if the person's anatomy isn't built the same as on the right as it is on the left? There's going to be inherent error in those findings. So the hallmark of Blair is precisely knowing how people are out of alignment so you have the right information, the blueprint on how to correct them. And in doing so, Dr. Blair's genius, he realized that our bone structure is not built symmetrically. We need to come up with a system that's able to get around the asymmetry that exists in bone structure so we can address the subluxation properly. And what Dr. Blair did, he realized that every joint in your body is a mirror image of one another. And if one of the vertebrae, especially at the base of the skull, is locked out of position, if we take an x-ray of the joint of the head and see one and look at the joint margin, we can see, is it even? Is it off this way? E.J. Palmer said chiropractic is specific or it is nothing. By looking at both margins, we can tell exactly how that vertebra is off. We can tell the angulation of the joint, and so we can very specifically correct that person.
The Blair analysis is the only one that I could actually learn how the vertebra moves. You understand why you have those angles, how the vertebra articulates with the one below, to learn when and when not to adjust, which is really important. So that's why I love the Blair work.
Our philosophy is that there's an innate intelligence in our body that runs the show, and if we truly believe that, that's what does the healing. When does it do the healing? When the vertebra is in position, not when it's locked, right? If it's locked, you have interference, correct it. If it's clear, there's no interference, leave the vertebra alone, let the body do the healing. One of our larger missions in the Blair Upper Cervical Society is to raise awareness, not only in chiropractic colleges. I mean, it starts there because we need more students practicing the work. That's one side of it. If you're going to be a master at anything, it requires dedication. If you go to every club meeting and go over the information step by step, the adjustments, the asymmetry, the listings, the stance line, all these things, I mean, that's what you should be doing, so when you graduate, you can hit the ground running with your technique. Even if you choose to do full spine work in your future, you're still going to adjust the neck. And if you're going to adjust the neck and you truly want to give your patients the best care that you can deliver, then you have to look into the Blair work.
I want to be able to make sure that I provide the best type of care for my future patients and knowing all the details about what really happens right here.
There is no greater satisfaction I've ever had in my life than having people come into my office who have been everywhere. They're suffering with post-concussion syndrome. They've had vertigo for 2 years every day. They've got Meniere's disease and they've got their ears shut. You get people in with depression and they're suicidal. And if you do your job right, this is the importance of doing chiropractic right. If you specifically correct the problem correctly and get the pressure off the cord, you will see miracles happen in your office every day.